A CT scan, or what is sometimes called a CAT scan, are basically the same thing, with CT standing for Computerised Tomography and CAT standing for Computerised Axial Tomography. What these scans do, and what are they actually used for? Well, at the basic level, a CT scan uses X-rays to scan the internal parts of your body. The tomography part comes from the Latin, which means tomos, meaning slice or section, and graphy, meaning study or writing. So basically, tomography is a larger image made up of smaller slices of images. The difference between a CT scan and normal X-ray is that a CT scan uses a hoop or a loop to scan a small slice of your body before moving on to a nearby part of the body to get more slices. These image slices then can be fed to a computer to produce a three-dimensional model of the part of your body, and then give medical professionals additional information about the issue they are investigating. This is in direct comparison to the kind of flat, normal X-ray photograph from a top-down image of the part of the body. It can actually be missing vital details about the size and location of the issue concerning. The CT scan enables a far higher resolution or a contrast to be achieved between the various parts of the body due to the 3D image created, and any suspicious items can't kind of hide behind any other organs or bones. So a CT scan involves a relatively small loop, that part of the body that's actually going through it. The patients actually don't experience the same kind of claustrophobia and panic that can come with the more enclosed MRI scanner. However, since in a CT scan we're actually dealing with X-rays, there always has to be an appreciation there's a small degree of risk when using X-rays. That risk though has to be balanced against whatever methods could have been used to achieve the same results. So for instance, a CT scan is far safer than a surgical operation to investigate what the problem is. The question then is, what degree of risk, and how can that turn into a risk that people can actually understand? Well, the first thing to say is that not all CT scans carry the exact same risk. It does depend on the area of the body which is actually being scanned and actually how large that area is. So that will take more sections and more scans. So in general, radiation dose that you may receive will be equivalent dosage to somewhere between 6 months and 3 years of normal living, since you get radiation dosage anyway. Alternatively, the same radiation dose of eating about 50,000 bananas. Or, to put it another way, you'd need an average of about 20 CT scans to take you over the radiation limit for a worker at a nuclear power plant. So a single CT scan isn't going to significantly increase your risk of, say, getting cancer. But if you have to have a large number of scans combined with radiation from other sources, you may have an elevated risk. So like X-rays, the number of CT scans taken by a particular individual do need to be carefully recorded so any possible risk can be kept as small as possible. And it actually shouldn't be overused as an investigation technique or tool by medical professionals.